Right now, it is time for our sports health segment presented by Oshner Andrews Orthopedics and Sports Medicine Institute. And with that, I want to welcome in Dr. Jeremy Burnham. Dr. Burnham, how are you today?
Hey, I'm doing great, Taylor. Good afternoon.
Good afternoon. Look, Hunt Palmer dealing with a positive trip to the doctor with the addition of his second son. Hunt had his second child yesterday afternoon, so I am in for him. But Dr. Burnham, not everyone in the NFL and sports in general is having positive trips to the doctor because sometimes sports injuries do happen. The big one that we learned last week was Kyrie Irving, the point guard of the Dallas Mavericks. He tears his ACL, and you know, this seems to me, at least, and again, I'm obviously no medical professional, that's why we're having you on, that it's almost, this injury seems like, to me, it's getting easier and easier to come back from. Can you kind of tell us what kind of recovery that involves?
Yeah, you know, unfortunately, there are still a lot of ACL tears that are happening, and I think you're right. I think recovery and treatment and all those things are getting better. But I'll tell you, we still are putting a lot of effort in trying to prevent these injuries from ever happening. And I don't think you can prevent 100% of these. You know, if you looked at that injury in specific, it looked like he just got knocked off balance and landed awkwardly on the leg. And you can't always plan that out. You know, in general, when we're talking about ACL tear, high-level athlete like that, you're looking at somewhere between 9 to 12 months for recovery is the average. And that's based on a couple of things. You have to get the strength and the coordination back. You got to give the ligament time to heal. But certainly we're learning a lot about it. There's a lot of things you can do to speed up that recovery or at least be more prepared when you do go back to return to sports. And so that's where all the focus is right now. Number one, preventing them. Number two, what can we do to get people back safer? We have an ACL Center of Excellence here at our new location at Elite. And we're developing a team of people that are trying to hit these ACL injuries from every possible direction, both to prevent them, but then when somebody does have them, how can we get them back as quick as possible?
Speaking of knee injuries, Dr. Jeremy Burnham joining us right now. Speaking of knee injuries, a guy who's coming back from a knee injury is J.J. McCarthy. So he actually suffered a torn meniscus first preseason game of last year. He wasn't able to return. Word is when offseason OTAs start, he's going to be a full go. As far as like maybe the similarities or differences between like a torn meniscus and a torn ACL, I mean, how similar are those two injuries?
So, you know, the thing is with meniscus, you can usually come back quicker than you can from an ACL.
Okay.
And sometimes when you tear your ACL, you'll also tear your meniscus. But if you're just dealing with the meniscus, a lot of times you're going to come back sooner. Sometimes all you need to do is go in there and trim out the torn portion. It can be like a little hangnail, a piece of tissue that's just flipping back and forth. And in those cases, those athletes get back very quick, sometimes within a few weeks from getting the knee scope. Sometimes you need to go in there and repair those. Maybe it's a bigger tear, or maybe it's in a spot where you really need to preserve as much of the meniscus as possible. And certainly that's where things have shifted over the last few years. There's a lot more of an effort to try to preserve the meniscus or save the meniscus than before. That can be more of a 4 to 6 month process. But either way, if it's just the meniscus, most of the time you're going to get that athlete back sooner than if it's an ACL. The ACL is unique because you have to give that ligament. Most of the time we're talking about an ACL, we're doing a reconstruction and we're putting a new ligament in there. And there's some things you have to do to just give that ligament a time to turn into an ACL. And even with all the technology we haven't really found a way to speed that up. So that's kind of the difference. But you'll see people come back pretty quick from isolated meniscus injuries sometimes.
As far as Dr. Burnham, and as far as maybe the most common lower body injury, or maybe the easiest one to come back from, in your opinion, like what do you think that is sports-wise?
You know, I think that when you're talking about knee injuries like this, I think knee injuries is probably the lion's share of the stuff we see. Of course, you see some ankle sprains, some Achilles injuries, some things like that, but knee is very, very common. When you tear a ligament in the knee, it's a really big deal. Probably the fastest one to come back from is an MCL injury. The MCL is unique because it has some healing capacity in the knee that the other ligaments don't have. And so you can tear your MCL, not need surgery, let it heal, and you can be back somewhere between 2 to 8 weeks from the injury, depending on how bad it is. Most of the other ligaments in the knee, if you have a complete tear, they can't really heal on their own, and that's why they lead to surgery. Sometimes we see these injuries where people just have a bad bone bruise, but the ligaments are okay. Those athletes tend to get back pretty quick as well.
Dr. Burnham, before I get you out of here, you mentioned to Hunt that it is National Athletic Training Month. Can you tell us a little bit about that?
Yeah, absolutely. Thanks for bringing that up. So it's National Athletic Training Month. That's March of every year. And I think that athletic trainers are probably, I think people don't realize how integrated they are into healthcare and how valuable they are. We have 25 athletic trainers in the Baton Rouge region that work for us. And, 15 of those athletic trainers are working with teams and schools on the sidelines. But the rest of them are working within our clinics and our ORs in different capacities. I'm going to give a shout out to one of the athletic trainers that works with me, Savannah. Anybody that's gotten care over here has probably met Savannah. And Savannah really coordinates and runs almost everything involving orthopedic care, from the OR coordination to clinic visits. She assists in surgery. And so I can tell you that, healthcare and especially orthopedics and sports medicine would not be the same without athletic trainers and what they do. They have and just an awesome body of knowledge, extremely hardworking, extremely skilled, great experience. And, I just really want to give a shout out to all the athletic trainers, both in Ochsner and outside of the Ochsner system. I think they work harder than most people realize. They're kind of the unsung heroes of orthopedics and musculoskeletal care, and certainly happy to acknowledge and honor them this month.
There's Dr. Jeremy Burnham. Dr. Burnham, thanks for hopping on with us today.
Great talking to you.
Yep, absolutely. Look, at Ochsner Medical, we know that sports injuries can be unpredictable, but one situation you can protect yourself from is safely returning to play after an injury. It's important to seek care by sports medical specialists who expertise is in rehabilitation. To learn more about sports injury prevention and treatment, visit ochsner.com/brortho.